So why is pulse pressure important? In a nutshell, pulse pressure is important because it can help us identify shock early in the patient encounter, sometimes before other symptoms occur. So what is pulse pressure? Pulse pressure is the difference between the systolic, or the top blood pressure number, and the diastolic, or the bottom blood pressure number. So systolic blood pressure, let's say 120, diastolic 80. 120 over 80, classic blood pressure. If we subtract 80 from that 120, we get 40. So the pulse pressure and a blood pressure of 120 over 80 is 40, right? And that's great. Normal pulse pressure, about 25% of the systolic blood pressure. So with 120, I'd want at least 30. We're at 40, it's a beautiful thing. But what happens, and where pulse pressure really makes a difference, is when I have a blood pressure of 102 over 88. We could look at that and say, gee, 102 isn't bad, it's still above 100. 88, wow, nice diastolic, and say, well, that's not a problem. But what's the problem? The pulse pressure is 14, and it should be 25. That's an early indicator of shock, and let's figure out why. The systolic blood pressure ultimately represents the cardiac output. It's that squeeze of the ventricle. It's the biggest number. So systolic represents cardiac output. Diastolic represents vascular resistance. It's what's left after that big pressure wave goes through. So remember, vascular resistance is the amount of tone constriction in the blood vessels. So let's think about shock. I'm losing fluid, whether it be bleeding, whether it's because of dehydration, diarrhea, whatever it happens to be. My cardiac output drops, my stroke volume drops. There's only so much I can do to increase my heart rate and make that better. So now the systolic, representing the cardiac output, drops. But what happens to the blood vessels in shock? They constrict. That means that my diastolic pressure is going to come up. So instead of 120 over 80, now I have 102 over 88. And that gives me a narrowed pulse pressure. Where is this important? It's important in your patients as an early sign. Don't look at that 102 over 88 and say, oh, those are good numbers. Think about what it means and why, right? Especially if you see other potential signs and symptoms of shock, such as anxiety or some early skin color changes, right? The second thing I want you to think about is the National Registry. You're given a series of vital signs. Will you recognize that 102 over 88 as abnormal and potentially an indicator of shock? Because that might be the only indicator in the question that you will get that the patient is potentially unstable. Picture it. Patient's in a crash, they're a little anxious. Here's the blood pressure. You've got to identify that as potential shock. Pulse pressure has a very important role in identification of shock. It requires you to take a good, accurate blood pressure and pay attention to the readings.